Jeez. That is real. No. This. Oh. You gotta plug it in. Lauren Lee, can you see what I have on my screen? I'm trying to do a screen share. Unmute. Unmute.
Sorry, I went to go grab my papers off the printer.
Where's the chat?
People reset and server. Could people stuff? That sounds fine. They don't always have coffee.
I want coffee.
Coffee so bad.
I haven't had coffee in 2 months.
Can you have decaf?
I can, but it's processed with formaldehyde, so I'm trying to avoid it. Right.
Coffee reset and server. 3 years required. Okay. 3 years required for barista? Yes. This host is that for like Starbucks or something? It's 34th Sprays Donuts. That? Oh wow.
Okay. What was I trying to do? Oh, okay. Yeah, settings.
Oh yeah.
Settings.
Massage therapist is for busy upscale spa.
You know what's not a bad idea is if you can do front desk at like a,
That's what I'm trying to do.
like they're all opening back up and some people,
Yes.
because then they can just rotate you from front desk to back of house.
And that's good because then you'll know the whole booking and all the
Yes.
You'll know all those
know
secrets.
all the stuff and junks. Book your own people so no one steals your people.
Exactly. Oh my god.
Okay, I need
That's like
to,
a fear of mine.
oh,
I'm
no.
afraid to like get clients. People are like trying to steal them.
No, she's not here.
Yeah, exactly. And like come in and it's like.
Well, and the thing is, once you are a therapist, you are not on front desk
Oh,
because they want to avoid that.
of course.
So, if you start off as a front desk associate and rotate into back of house, you don't like switch back and forth, because if somebody calls for you and you know who they are and you're like, oh, I want that client, they're a good tipper, you know, which is really unethical.
Right.
But they avoid that. So they're like, nope, you don't do front of house anymore. You're only back of house.
So can you lose your license if someone takes you for massage? No, or is that just for, like first?
That's
year
in
that
school. That is in school.
Okay.
Wait, what?
Because we're not allowed to accept tips for massage here, so I didn't know that was like in like the real
Why?
world.
Oh, yeah, that looks wrong.
Yeah.
I don't understand.
Okay, good.
That is not what I want.
Where's the
I-
wave?
I want duplicates. That's what I want. I want to see it here and there. There we go. Okay. A little bit of a learning curve with the computer. Now I got it on the projector. I've got it on the computer. I've got it shared to them.
So we can only take notes or?
Yeah.
Okay.
Just take notes. Once we talk to Carolyn, we get to go ahead that these are your books. We can't.
I'm like, I'm in the page, you see.
Well, you bent it. Oh,
Yeah,
that's fine. As long as you didn't write in it.
No.
But you guys are probably fine when it comes to financial aid because we did have that little thing in your reentry packet.
Yeah.
So if anything was wrong, we would have caught it there. I need, like, for my checklist, I have to have a golden ticket to. I got to do my part.
Right.
So, what time is it? Let's make this Zoom chat very tiny. Oh, no Stacy today. Okay.
So has it been weird, like, talking to a computer screen?
I feel so dumb.
Like YouTube.
I was just thinking, like, it's like you're vlogging.
That's what it feels like. That's pretty accurate.
Hey guys, now we learn massage. You're like, welcome back.
I don't understand. Like, this is what this should look like, but it doesn't. This is gonna go on YouTube too, so it'll be 10 minutes of me trial and erroring.
Oh, that sucks.
Okay, same thing. Everybody can see the same thing. She can see what we see. Let's go ahead. Try that again. Try it again.
Ah! Is that like the first slide? What is that?
No, the first slide is
What you have? Oh, that's the.
I just don't understand what I did wrong. It's extended displays, and that's not what I want. Display settings. Duplicate slideshow. There we go. Yeah.
Got it.
All right. Okay. Let me get this door because I tend to talk loud.
Nobody wants to hear me except you guys.
So we have effects, benefits, and indications and contraindications of massage. So before we turn in our book, in our slideshow, in our book, I want to punctuate, where do I want this? Here. The learning objectives. So once we are done with this chapter, we should be able to talk about these learning objectives, which we probably will later today. Now, we want to be able to explain the physiologic effects and benefits of massage, describe the effects of massage on the skin, describe the effects of the massage on the muscular system, describe the effects of massage on the nervous system, describe the effects of massage on the circulatory system, explain the psychological effects and benefits of massage, list 17 conditions most frequently relieved by regular massage treatment, differentiate among absolute, regional, and conditional contraindications, list at least 6 common contraindications for massage, identify the major endangerment sites on the body. So, you will see those little medical terminology packets I handed out earlier. Those are just going to be a good reference guide as we're going through this chapter because it is going to have some medical terminology. So it'll help you kind of decipher. The more you learn these words and the prefixes and suffixes, the easier it is to read some of this text. So I wanted you to have that, just like a little cheat sheet dictionary. Google also helps when you have prefixes and suffixes. But the more you're familiar you get with them, when you see them repeatedly, you're like, oh, that means this, and it's talking about this body part, so that must be above this body part, or,
Right.
whatever it is. maybe. Okay. I'd like to progress through the slideshow. That's the next obstacle we have here. Aha! I have to click on the right box. I have 3 boxes up here. I have to make sure I'm in the right one. So there are 2 types of physical effects. We have mechanical and reflex. Reflex effects are indirect effects on the body through nerve or energy pathways. These masks,
Yeah.
I'm winded. Mechanical effects are direct physical effects on the tissues contacted. So do we understand that concept? Reflexive effects are effects on the nerves, right? The actual signal being sent. Mechanical is what we're actually touching, right? And how it is reacting to the touch. So within our introduction in our text here, we have a sentence that says, many healthy people believe that frequent massage helps them remain physically, mentally, and emotionally fit, right? So I would call that a benefit, right? And then we get into that term we were talking about a little bit earlier, contraindication. This is a highlight. Lauren, if you've got your book out. A contraindication is any physical, emotional, or mental condition that would cause a particular massage treatment to be unsafe or detriment to the client's well-being. So that means that massage is going to hurt them more than it could help them, right? While they may undergo some benefits, that condition causes them, okay, no, we cannot do that. We're going to hurt them more, all right? Down into the text, we see massage has directed physical, psychological, and physiologic benefits. Physically, massage increases metabolism, hastens healings, reflexes, and refreshes the muscles, and improves the function of the lymphatic system. But by and large, the massage on a healthy person helps them maintain their well-being. No, I don't think it was in the skincare text. They have the wellness model. Have you ever heard of that? Or people who strive for wellness fit on a scale, where 0 is just like, you're not unhealthy, but you're not healthy. And so people who strive for wellness are in a +3, right? They exercise, they eat right, they're on a lot of medications, they don't smoke, they don't drink. You know, those are the +3 people. And then like the general public probably lives somewhere in between like a 1 to 2, something like that, and it goes up to 5. That's, you know, occasional drink, maybe you smoke, occasional fast food, that sort of thing. You don't live off of fast food. You don't, you know, you're not my 600-pound life. Because those people getting massage, it might be a detriment to them receiving massage because of contraindications. All right. Nope. Get back in here. Click that. Okay. So effects on the muscular system. Massage increases circulation and nourishes the muscles. Relaxes tense and spastic muscles. Aids removal of metabolic waste. Relieves post-exercise stiffness and pain. Speeds healing and reduces adhesions. Increases range of motion and flexibility. Most of the time when you see range of motion, you will see ROM. Little acronym we use so we can do some shorthand, because when you start taking notes in clinic, you need to be able to condense instead of a novel. You know, we get a couple sentences. Right. In the text, we see under muscular system, mechanical effects enhance local fluid uptake in the muscles, deform sensory and proprioceptive nerve endings, and stretch or compress various muscle and connective tissue. Now I'm going to read this next little chunk here in the muscular system portion of the text. We see massage techniques directed at the spindle cells and Golgi tendon organs initiate reflex actions to release muscle tension and reset muscle tonus. Muscle tissue that has suffered injury heals more quickly with fewer connective tissue adhesions and scarring than when therapeutic massage is applied appropriately and regularly. A study conducted in 2011 at McMaster University in Hamilton, Canada shows that muscle tissue that is acutely damaged through exercise benefits from massage therapy by reducing the production of inflammatory cytokines. Massage in such injuries may reduce pain and at the same time stimulate mitochondrial production and promote cellular repair. Now, there's a lot of words in there that might seem a little confusing. We will break them down later. I'm getting to a portion of the text where we needed that context. So, the massaged muscles show a significant increase in genetic factors related to mitochondrial growth and cellular repair, while at the same time producing 30% reduction in inflammatory factors, thus reducing the cellular stress from acute muscle fiber injury. This is the context I needed. Massage, however, is contraindicated in the acute inflammatory stage following soft tissue injury. When the initial swelling has subsided, appropriate massage enhances the healing process. So do we know what the word acute means? Not small, but quick onset, fresh, right? So we have chronic and we have acute. So when things are in the acute stage, i.e. you've just done the injury and the initial swelling is there, that is when we cannot touch. Now, when we've reduced the initial swelling, that's when we can go in, but it is conditional to each condition, right? Some things you can't go into the subacute phase and other things you can. Now, learning all of those make your head spin. That's why we have textbooks always to back us up when we're in the field. Now, you need to learn this stuff when you start taking your MBLEX and doing your massage prep, but you will always have a text to back us up. We're Zooming too.
You're Zooming too. We're Zooming.
I've got my 10 a.m. Zoomers.
How are you guys?
Good.
How are you? Good. Good. All right. Well, I just wanted to stop in and say hi.
You look nice and tan.
Yeah, you look so nice.
Since she's already interrupted.
How are you feeling, Miss Becky?
Can you show me at some point in time, because she still has to do face torso, spine, and hip like thigh, because she was sick.
Yes. Everything's
How to
going.
open it up just for her through Sunday. She's gonna try to do it during, yeah, just for one person.
Is it in her cohort? Oh, okay. I'll have to fiddle with it then. I can't. I was gonna say just go in the grade book and.
No, yeah, it is in their cohort. It is
Oh,
in, it is in
just
C. It is.
Find it in the cohort, and then on the grade book, it'll say like a bunch of zeros because it hasn't been completed. Click on the 0, and then open up a box, and in that box
Change
there's a
the
little,
date just
there's
for
a little
her.
calendar in there.
Perfect.
It should be pretty straightforward. That's all right. We needed a break. All right.
This works great, by the way.
Good. All right. The effects depend on the mechanical or reflex reaction of the nerves affected. Stimulating techniques are friction, percussion, and vibration. Now, do we know what any of those terms mean? Friction, right? We can do friction deep in the muscle. We can do superficial friction, right? Percussion, equipment, and vibration. You can use that with your hand or a mechanical device, like you see things that kind of like a jackhammer. You see those tools at, I used to work at Massage Envy, when we had an RTR, and that was our vibrational tool. But it was pretty
Some of them are, like,
intense.
scary.
Some of them are scary. You have to have the right know how to use them so that you aren't sending that right over a bony prominence, because hitting bone with that, it's gonna hurt, or you could even break a bone. Like, it doesn't take much pressure to break your collarbone. I think it's like 7 pounds of pressure.
Yeah.
So not that you would be doing anything percussive, up through here, but just to give you an example of how fragile we actually are. We're pretty delicate creatures. I mean, we're resilient, but we're delicate. Right. And then sedative techniques are gentle stroking, light friction, petrissage, and holding pressure or static pressure. Do we know what we mean when we say petrissage?
Yeah.
Right?
Like pinching, right?
Like kind of kneading,
Yeah.
right? I think of it as like dough and kneading dough, right? Holding pressure, static pressure, is when you are on the tissue and you're not moving, but you're in the tissue. You've kind of compressed into it a little bit, right? But not so much that we're pushing on her, right? Yeah, we're not trying to crack somebody's back, and we're not doing CPR. I really want to take my mask off. All right, I want to talk a little bit about joint movement as well. Massage can have positive effects on range of motion, or we see that abbreviation there, range, or ROM, of the limbs that have limited range because of tissue injury, inflammation, muscle tension, and strain. This is going to be one of the things you do the most in massage, is people will come in and they say, I can look this way fine, I can tilt my ear fine, but when I turn this way, I get stuck, right? And so your goal for that massage is going to be improve the range of motion of their cervical spine, right? So we will have the tools and the know-how, further down the line. Don't expect you to know all that stuff now. But it's something you're going to need to become familiar with. The client might have experienced discomfort or pain resulting in the limited use of limb, or you might have stopped using the limb completely. The body has an amazing way of guarding itself if there's an injury, and it compensates. It's like, okay, we can't use that, so instead of turning our head to look, now we're going to turn our body, right? And so maybe now the low back is experiencing some issues because they're using the whole body to turn and look this way. Or when they're driving, they don't check their blind spot because they're like, well, screw it, I can't look that way. Look, let's go over here. All right, here we go. Right? I think we've all experienced that in Florida.
Yeah.
Right? So the limb must be taken through the range of motion passively. And so what that means is you are doing it. The client is letting you move their head through it. They're not moving their head. So that's where you can help find restrictions in their movement, because they aren't activating those muscles. And carefully the range is increased, or gradually, excuse me. So passive movement is the method by which the joints are moved through the range of motion with no resistance or assistance by any muscular activity on the part of the client. You are doing the work. Passive for them, not for you. Passive movements benefit blood and lymph circulation, nourish the skin, relax and lengthen the muscles, soothe the nerves, and lubricate the joints. So if you think about it, when you are moving a muscle, but it's not actively being contracted, right? We don't have that tension on the musculature. So it can move through its range of motion easily without that restriction that it feels when it has the actual contraction. Does that make sense? Okay. Active joint movements in massage refers to exercises in which the voluntary muscles are contracted by the client and either resisted or assisted by the therapist. Active joint movements have beneficial effects similar to exercise. They help firm and strengthen the muscles, improve circulation, and aid in the function of related internal organs. So that consists of active assisted, where say they are having some trouble, I should turn here, having some trouble with this shoulder. Hi. And they are lifting their shoulder up, but instead of doing a straight up motion, where their arm is coming up. They've kind of kicked out, and then they've had a modified motion. So we can assist them and pull them through what the actual range of motion could be. That's active assisting. I'm assisting you move through the range of motion. Then we have active resist. Can you imagine what that means? We're creating some resistance for them. So if they were lifting that same shoulder and you were pushing it down, right? Just giving some resistance. If I pass out today, this is why. Okay. Mostly reflexive effects from massage. Shorter sessions activate the sympathetic system and create an alert and energized state. Longer sessions activate parasympathetic system and have a sedative and relaxing effect. When we think of parasympathetic nervous system, I want you to think of the terms rest and digest. Kind of glue those two terms together. And it'll make more sense when we get to the nervous system chapter. But just plant the seed right now. So the nervous system, I'm on page 290, about halfway down. The nervous system can be stimulated or soothed depending on the type of massage movement applied. That's a highlight. And then we see under that, numbers 1 and 2, stimulating massage effects are friction, percussion, vibration. We see sedative effects, gentle gliding, light friction, holding pressure. And then we're getting into effects on the autonomic nervous system. For those of you who have your books at home, an entire portion of effects of the autonomic nervous system is a highlight. Highlight that whole portion, and I'm going to read it now. Effects of massage on the autonomic nervous system are mostly reflexive, like we see on our slide here. The autonomic nervous system is divided into sympathetic nervous system and parasympathetic nervous system. The sympathetic nervous system is responsible for preparing the body to expend energy in response to emergency situations, commonly referred to as fight or flight. I think everybody's probably heard that terminology. Activation of the sympathetic nervous system is related to stress, real or perceived. You ever get like that? You think you see a spider or something, and that like cold tingle that goes up your body, and then all of a sudden you realize, oh, it's just a crumpled piece of paper, I'm fine, right? That's your fight or flight, right? But you perceived a real threat and your body was like, let's get ready to go, we're gonna have to move. So there's your fight or flight in action or reaction kind of. And it's residual from our caveman days when we really did have to either stay and fight or flee to survive, right? It's baseline instincts that are residual. So sympathetic stimulation initiates an accelerated heart rate, blood is diverted to muscles, elimination and digestion are inhibited, right? Adrenal secretions of epinephrine or adrenaline and norepinephrine are increased, sweat glands are activated, and the body is more alert and attentive. So when you are going into fight or flight mode, your belly is not worried about like, let's get lunch all processed and packaged and ready for elimination. No, the body's like, we don't need that right now, just hold on to it, everybody freeze, all of your working parts, just stop. We need all of that working movement to go elsewhere, to be able to use the muscles to run, to fight, right? We need to sweat because we need to eliminate metabolic waste still. We need that epinephrine and that norepinephrine because the epinephrine is the adrenaline, right? That sends everything into action. We need that norepinephrine release so that we can bring it back down because it's counterpart. We have increased heart rate because we need to be pumping blood faster to get to those muscles to make them work more efficiently. And then if we were our more baseline ancestors, you ever see when a cat or a dog gets scared or startled and they're just in the ears, right? Everything stands up and they're like, oh, I can hear and see and smell everything now. That's essentially what our body does just in a more baseline form because we have evolved to use tools and whatnot. But you're more attentive, the world starts to move a little slower and you can perceive every little thing. You see that spider on the floor and they're like, is there more? Look at all the surroundings, you analyze it really quickly. That's what I do. And then I'm like, okay, we gotta burn the house down. I found a spider. All right, so that is the fight or flight sympathetic nervous system. Parasympathetic system is responsible for counteracting the effects of the sympathetic nervous system and stabilizing and normalizing and restorative functions of a non-alarm state. So we aren't freaking out about the spider anymore. Stimulation of the parasympathetic nervous system reduces heart rate, increases digestion, that's that rest and digest, right? Increases internal circulation of the internal organs in a relaxation, restorative response. The sympathetic and parasympathetic nervous systems work together to maintain homeostasis, so that one doesn't pull us in one direction more than the other, right? They have to work together because homeostasis is home, right? We always want to stay at home. We want to maintain all our baseline levels that we need for a functioning human body. Okay, initially, I'm getting real excited. I'm breathing in my mask. And initially, massage seems to alert the sympathetic nervous system. Short, invigorating massage, such as pre-event sports massage or 15-minute chair massage, tends to stimulate the body, leaving it more alert and energized. Longer, relaxing massage, however, seems to affect the autonomic nervous system by sedating the sympathetic nervous system and stimulating the parasympathetic nervous sedating the sympathetic nervous system and stimulating the parasympathetic nervous system. As a result, blood levels of epinephrine and norepinephrine are reduced, heart rate and blood pressure are reduced, relaxation response is increased, and the body has an opportunity to rest and repair itself, right? So it's got to recover from that, like, ugh, right? And then we see the word homeostasis, the body's internal balance. Whew. I'm gonna need a nap. I have a pre-dinner nap and a pre-bedtime nap. It's wonderful. All right, so effects on neurotransmitters. The effects on neurotransmitters is it increases serotonin, dopamine, endorphins, and enkephalin levels, and are related to elevated mood and pain control. So that's an effect of massage. So we can infer from this slide here, if we're affecting all of these, we're pretty good for pain management, right? Now, I have seen more recently with the opioid epidemic specifically, doctors less likely to prescribe something as a pill for pain management and more so exercise or massage or chiropractic or physical therapy because the incidence of addiction is so high, right? So that's become more popular, is to facilitate these ways of pain relief as opposed to just take a pill, it'll go away. Right, and I think it is, and I think people get a better sense of self out of it, personally, and that's a personal opinion of mine. But I'm always, if you don't have to take a pill, don't. But if you need to, do it. The doctor said so. Yeah. Right. Short, invigorating massage increases epinephrine and norepinephrine levels, leading to an alert state. Longer sessions have the opposite effect, like we just discussed in that paragraph prior to. So I am on page 291, about 3/4 of the way down. And we see where it says, studies also indicate, and this is a highlight, studies also indicate that massage has been found to increase levels of serotonin, dopamine, endorphins, and enkephalins, neurochemicals related to elevated moods and pain control. Epinephrine and adrenaline and norepinephrine or noradrenaline are produced in the adrenal medulla and are excreted into the bloodstream in response to stimulation of the sympathetic nervous system. These hormones are also neurotransmitters that stimulate the alertness and attentiveness in response to fear or in preparation for fight or flight response. Epinephrine functions in the body Norepinephrine is active in the brain. No. No. Okay, I want to talk a little bit about dopamine. We'll find here at the bottom. Dopamine is a neurotransmitter that affects brain functions and controls fine movement, emotional response, and the ability to experience pleasure and pain. Elevated levels of dopamine lead to feelings of pleasure and excitement and improvement of mood, alertness, and sex drive. A decline in dopamine in the brain is linked to cognitive and movement problems. And we have a highlight here. Parkinson's disease is caused by the body's inability to produce dopamine.
Oh, I didn't know
Mm-hmm.
that. So that's the reshape, right?
Mm-hmm. And the essential tremor doesn't always, I mean, it does a lot, but it's not always the first sign.
Mhm.
Most of the time you'll see mood swings are the first symptom of Parkinson's, and and it tends to be in someone who naturally was an even-keeled person, and when you see them have these mood swings, something's not right. Right. So when you can't regulate your moods because you don't have the right levels of dopamine, things can deteriorate. Parkinson's is a hard disease.
Yeah.
It's hard on the person who has it, and it's hard on the caretaker. But we see as part of its job is to help with movement. That's where that tremor comes in. Now I want to talk about serotonin. Serotonin is a neurotransmitter that is synthesized in the brain and found in the brain, bloodstream, and intestinal walls. That is a highlight. Serotonin has a broad range of influences, including mood, behavior, appetite, blood pressure, temperature regulation, memory, and learning ability. Serotonin seems to modify behavior in the way that counterbalances the effects of norepinephrine. Whereas norepinephrine is released in response to stimulants, stress, and anxiety, serotonin promotes a sense of calm and well-being. It seems to regulate moods in a quieting, comforting manner. Serotonin levels also suppress outbursts and irritability while reducing cravings for food and sex. A low level of serotonin is implicated in depression, eating disorders, personality disorders, sleep disturbances, and schizophrenia. So, if we aren't producing serotonin properly, you can see where people would start with their eating disorders. They're constantly craving things that aren't necessarily good for them, and in turn, those things that aren't good for them are aiding the fact that they aren't producing serotonin, so they just kind of facilitate the deprivation further. Massage increases levels of available serotonin and dopamine. So just getting massage, if you can just up those levels, you generally become healthier with regular massage. I think everybody should get a massage as long as it's not going to affect them detrimentally.
Right.
I think it should be just like part of society, but I'm kind of a little biased. Just a little bit. But I think everybody just needs a chill pill, and I think massage is it.
Yeah.
It's kind of okay. All right. Massage increases the secretions of endorphins and enkephalins in the central nervous system. These elements are mood elevators and natural painkillers. Endorphins interact with pain receptors in the brain and in a similar manner to that of morphine and codeine. So we create our own natural painkillers, right? It's just how do we facilitate the production of those in the body? Besides reducing the sensation of pain, enkephalins and endorphins are related to feelings of euphoria, appetite control, and enhancement of the immune system. So what I keep coming back to is if the body isn't producing these things, so appetite control, right? When you crave something, if you're on the bad end of the craving spectrum, it's usually trash, soda, sugar, salt, you know, overabundance of whatever. And those contribute to raising levels of other things that contribute to lowering levels of things that you need. And so you create like this cycle. I want more, it's decreasing this, I want more, it's decreasing this. You know, how do you break that cycle? Massage. All right, let's see. Yes, this is where I am. Okay, gate control therapy. Effects on pain, gate control therapy. Let's talk about gate control theory. Massage is effective, this is a highlight, in reducing pain because of several neurologic processes and conditions. The positive effects of relaxing massage interrupt the transmission of pain sensations on effective nociceptors from entering the central nervous system by stimulating other cutaneous receptors because of gate control theory. I really want to say therapy. According to gate control theory, painful impulses are transmitted along small and large diameter nerve fibers from nociceptors to the spinal cord and then to the brain. Stimulation of thermo or mechanical receptors by rubbing, massaging, icing, or other means, where'd it go? Transmitted along larger fibers and suppresses the pain sensations at the gate where the fibers enter the spinal column. Okay, so what does that mean? When you have a pain sensation go through the brain, it goes through transmitters, right? It's a signal. Boom, 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 boom. It's not a straight plug it in, we have straight power, right? It's not a constant stream, the flash, right? Each time that flash goes through the neurotransmitter, it becomes a stronger signal, a stronger transmitter, right? And so we initially hurt something and the transmitter is skinny, right? And the more that that signal is transmitted, the deeper ingrained and larger that transmitter becomes, right? The pathway in which it's transmitted, right? So if we have a large pathway, it's no holds bar, that signal can transmit. Bam, 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 right? Now, let's say we interrupt that signal with the stimulation of massage. That transmitter is even bigger, right? So it's easier, yeah?
Sorry to interrupt. If you check your emails and you have any students asking if they're required to do a face towards the spine, just tell them no. Modules we've added to MindCap, we can't open it for book.
Oh, okay. I forgot about that.
I'm
Okay.
opening it for Lois, so if other people ask, no, they don't have to do it again.
All right, absolutely. So if we stimulate a larger transmitter pathway, we override that pain signal, right?
Causing more pain?
What?
It's causing more pain?
No, we're interrupting it. So we're taking that pain signal that had a large signal, right? It's ingrained. And we interrupt it with an even larger massage stimulation, right? We've cessated the feeling of pain, right? Now, when we stop massage, what's going to happen? That guy's going to start back up again. But we can train the brain with gate control theory to kind of lessen the pain response, the pain impulse, and listen more to the massage impulse with more repeated massage. Does that make sense?
Yeah.
The way I think of it is like kind of like a garden hose versus a fire hose,
Right.
right? If you had a garden hose and you're putting a fire out,
Yeah.
right? Versus when you turn the fire hose on and okay, we've got an actual stream here. That's the way I kind of think of it in my head, just in like gauge wise. All right. It increases release of endorphins into the bloodstream and increases the release of enkephalins in the bloodstream. And we remember that those are the feel-good stuff, the natural pain relievers and the natural mood elevators. So if we implement those as well, we're going to be able to cessate pain in addition to sending a different signal along a different thread. That crept up on me. Okay. And so we see that down here at the bottom of the page. I can see it. As mentioned, massage also reduces the sensation of pain by increasing concentrations of endorphins and enkephalins and other pain-reducing neurochemicals. We see that here. Massage can be relieved by referring myofascial pain and reduce ischemia-related pain by releasing hypersensitive trigger points and restoring circulation into hypertonic muscle tissue. That sentence, I do not expect you to understand. We will get to that when we get to chapters 15 and 17. That'll make a lot more sense. But there are techniques that we can learn to be able to reduce when you feel an adhesion or a nodule that will reduce the ischemia in the tissue. And ischemia just means a lack of blood flow to that area. And as we bring in blood flow, we're bringing in fresh nutrients, right, with new blood flow, right? And so when we bring in new stuff, we're pushing out old stuff, which is getting rid of all these metabolic wastes that have built up and generally just making the tissue more healthy. Essentially what they say right there. I'm gonna have to sneeze again. I'm not happy about it.
Like over here, like a cat, like.
I mean, you don't realize how many times you touch your flipping
I
face.
know, literally, I'm just over here like.
Yeah, I'm like, yeah.
And my face is so itchy because it's so dang dry, because the parasite's taking everything. And she does. She's sucking the life out of me. But oh, I just want to scratch my skin off. Okay, so effects of on the circulatory system. The circulatory system, we know what that is. That's all our blood vessels, our heart, and oxygenating blood and moving it through the capillaries back. So we have, we kind of need it. So increase in quality. I sound like Walter Kripke from Big Bang Theory. Increases quality and quantity of blood flow, decreases the workload on the heart, increases the number of red and white blood cells, tones vessel walls and relaxes vessels through vasomotor nerves, and temporarily reduces blood pressure. So pretty much all the words there are pretty self-explanatory. One that might be tripping you up a little bit is vasomotor. So when we see VAS, V-A-S, that means a vessel of some sort. Motor just means a motor response. So how something can constrict or expand. So vasomotor nerves, when we have a constriction in a vessel versus a enlarging of a vessel. That makes sense. So it helps relax vessels through vasomotor response, right? It just helps them expand a little bit. And if we don't have a constricted vessel and we open up the fire hose and blood can flow freely, life is good. All right, so clinical massage affects the quality and quantity of blood coursing through various parts of the circulatory system. Increased flow of blood to the massage area results in better cellular nutrition and elimination. The work of the heart is lessened because of the improvement in the surface circulation. Blood pressure and heart rate are temporarily reduced, while at the same time, systolic stroke volume is increased and capillary beds dilate and become more permeable. Do we know what that word permeable means? A permeable membrane, things can pass through easier. So when we have capillaries, when we have in our blood, we have oxygenated and deoxygenated blood. When we get to the capillaries, that's where we kind of loop back around and it goes the other direction and it's deoxygenated, right? Mm-hmm. So capillaries are one cell thick. We have to be able to have that oxygenation, deoxygenation take place, right? So the blood is diffused, permeates through the capillary, and moves on back to be oxygenated again. When you are improving that permeability, your deoxygenation to oxygenation, because all the vessels are improved, works more efficiently. All right. Under the influence of massage, the blood making process is improved, resulting in increased number of red and white blood cells. I wanted to make that all one word. That whole sentence. I just wanted it to be one word. Studies at the Touch Research Institute in 1986 showed an increase in the presence and activity of T4 killer cells in the bloodstream of people with HIV after receiving massage, indicating that massage might strengthen the immune system. So those T4 killer cells, those are what have the ability to attack incoming threats. Problem with AIDS is that it has the ability to hide itself. And so even though your immune system may have killed off some cells, it's lurking somewhere ready to replicate itself again. That's what has made AIDS so tricky to deal with. But in researching AIDS, they found out that massage is improving the immune response, which is pretty cool. Massage can influence blood and lymph vessels by either direct mechanical action on the vessel walls or by reflex action through vasomotor nerves. Pressure against the vessels not only tones their muscular walls, but also propels the movement of blood. The vasomotor nerves, by controlling the relaxing and constricting of blood vessels, determine the amount of blood that reaches the area being massaged. So I'm sure we talked about this a little bit in skincare. When you are massaging someone, we have our centripetal massage. We're going towards the heart, like on the arms.
Yeah.
Right? That is because when the heart pumps, pushing it out, right, to get where it needs to go, the body doesn't have a pump on the opposite end, if you will, pumping it back up, right? It's all relying on the pressure of that system. So when you pump out, pushes everything through, and then it kind of pushes it back up, right? So if we were to push down on something that doesn't have a pump to keep itself moving forward, we're going to have detrimental effects on the flow of that blood. So on the legs and on the arms, we want to push it towards the heart so that we are helping it move back where it needs to go instead of pushing it down away because it doesn't have its own pump. It has valves that open up, they stop it, they don't keep it moving. It's all a pressurized system. I kind of think of it as like in your car, your pistons don't go unless you have a pressurized head gasket. Does that make sense?
Yeah. No,
Okay, it worked with one of you, 50-50, it's okay. We will find something that makes sense to you.
Okay.
All right. Massage movements affect blood and lymph channels in the following ways. Number one, light gliding produces an almost instantaneous, although temporary, dilation of capillaries. And you can see that when you do just light work on somebody, you start to get a little pink, right? That's that blood circulation improving almost instantly. Light percussion causes contraction of the blood vessels, which tend to relax as movement is continued. I don't mean like you see Helga in the videos going, grrr. I mean like lighter stuff. Friction increases the permeability of the capillary beds and produces an increased flow of interstitial fluid, which creates a healthier environment for cells. Properly applied, light massage enhances lymph flow and reduces certain types of edema. Do we know what edema is? Okay, all right. Compression produces hyperemia or increases the amount of blood stored in the muscle tissue. What time is it? Okay. I'm in the way of my clock. Oh, I don't have a clock. Ha! Okay. Psychological effects of massage. Rebuilds self-image and self-worth. People feel healthier, more energetic, relaxed, and better able to cope with stress. Reduces depression and anxiety. Promotes awareness of tension patterns. Encourages proper nutrition and exercise. So, massage. When you have someone who comes in for massage, I think generally they're in the headspace of wellness, right? They wouldn't be there if they didn't want to feel better. Right? Nobody goes and get a massage and be like, I would like to be beat with a baseball bat, please. I would like to leave with more pain than when I came in. I've never heard someone say that. So when you are massaging someone, they're already in that headspace. Now, the psychological effects of rebuilding self-image and self-worth. Some people may have, especially in our society, a negative self-image because of Instagram, TV, whatever. And the way I look at it, all bodies are beautiful, right? It's just, we're all different shapes. There's no cookie cutter. I know, we would all just be all beanpoles, like trudging along. Like shapes are what give us personality, right? I am all for body positivity. And I think that being aware of your self through a massage is very helpful to some people. I do think that people who have had traumas involving sexual trauma can kind of reclaim themselves through massage. And not that only being the facilitating factor, but I think it's a helpful factor to finally learn what good touch, desexualized good touch is, right? Not all touch comes with pain is what it basically teaches them. So that kind of is a self-esteem thing to help them rebuild up on the inside. I haven't worked with a lot of people who had sexual trauma. I've been a therapist for 12 years, maybe 2 people, right? And it wasn't like
they were open about it.
They weren't very open about it. And when I was working on them, it was probably 20 years prior that it had happened to them. And they kind of opened up maybe a couple years into our therapeutic relationship. But they would say, massage helped me understand what good touch is again. So that's a psychological effect, right? If you only feel touch a certain way, just like those transmitters in your brain with pain, right, you're going to intercept touch as bad, period. Right? So you have to be able to work with people like that. Massage is really powerful. I'm really, really passionate about it. I don't know if you could tell.
Yes.
I really like massage. I'm over here. And so that's what this next little chunk in this paragraph here talks about. Victims of sexual abuse and rape indicate having improved self-image and reduced aversion to touch. I haven't experienced it personally, but you see it like in movies where someone who has gone through sexual trauma and someone that they know and love and trust touches them. And it just sends them to a headspace where touch is associated with bad, don't touch me, And so it helps them reclaim their area, their boundaries. Massage is great for establishing boundaries because we have to be so clear and concise with them that the things massage can facilitate are amazing. I'll just leave it at that. So let's move down to the end of that paragraph there. When receiving massage, the client has an hour to herself, an opportunity to literally get in touch with her body. When you're laying on a massage table, I don't know, at least for me, I kind of feel like Jell-O. Where do I end and where do I begin? But then when the therapist puts their hands on me, I'm like, that's where my leg ends. Oh, there I am, right? I'm not as big as I thought. Okay, I'm tight. Okay, right? I kind of get more aware of my actual spatial area that I'm taking up. So it puts you in touch with that. Massage helps clients become aware where they are holding tension, where they might have tight muscles or painful areas. I have had so many people while we're working, and they're like, oh my gosh, I didn't know. This is the shoulder that always bothers me, but where you are right in the front of my shoulder, that hurts just as much. And it's just kind of like you let them realize, like, hey, the body is always, there's 2 sides, like a lever and pulley system. If one side hurts, the other side is going to be compensating for it. So we're going to have some deviation and some problems going on the other side. This side's just screaming too loud, right? So it's like, yeah, this guy hurts, but let's address this too. All right. Oh, nope. Back. get into the slideshow, then we can go forward. All right. Oh, nope, that's where I want to be. Conditions relieved by massage. So these are the 17 conditions that they were talking about. I know. When it gets to noon, we'll take like a 10-minute break so we can demask ourselves. I know. I'm sorry. I'm sorry. I'm right there with you. So, conditions relieved by massage. Relieves stress, tension, spasms, and pain. Reduces mental and physical fatigue. Makes muscles and joints more supple. Prevents, relieves post-exercise soreness. Improves circulation, improves digestive function. Let's go over here to this list on page 295. Almost all healthy people occasionally have some physical condition that massage can improve. When relief is obtained, the client feels a renewed sense of well-being. No matter how well a client is, a good massage can leave that person feeling even better. So the following conditions are the most frequently relieved by regular massage treatment. We see, no matter if you're healthy, you have stress and tension. That's just life, right? Stress and tension are relieved. With a relief of tension and stress, the client feels better able to cope with day-to-day situations. Mental and physical fatigue. Yes. Oh, okay. Everybody else has popped in and had stuff to say, so I was just like, what? Mental and physical fatigue is relieved, leading to renewed energy and more mental clarity. Pain in shoulders, neck, and back when caused by strained muscles or irritated nerves is relieved. Muscle and joints become suppler, and soreness and stiffness are relieved. Muscle and soreness from overexertion can be reduced or prevented. Digestion, assimilation, and elimination are often improved. Facial massage helps tone the skin, helps prevent blemishes, and softens fine lines, which you guys found when you did your skincare course. And then we have a highlight here. Headache and eye strain are often relieved. Deep relaxation is induced and insomnia is relieved. Muscular spasms are relieved. Obesity or being overweight and flabby muscles can be improved when combined with proper exercise and diet programs. And massage. Massage will not make you skinny, but implemented with can help improve. Pain in joints and sprains are relieved. Increased relaxation and stress relief encourage healing. Mental strain is reduced, resulting in better productivity. Mild high blood pressure is temporarily reduced. Constrictions and adhesions can be reduced or prevented as traumatized muscle tissue heals. Range of motion can be increased. That's in a healthy person. That's in a moderately healthy person. These are all the things that we can help improve, right? So when you're facilitating regular massage, how much do you think that person's life is going to improve, just generally as a whole? It's part of a whole like wellness model. I think that's what it's called, wellness model. And with the scale that I talked about a little bit earlier, I have, when I was working full-time, I did have a lot of people who were health people that, they said the only thing that kept them feeling well to keep them exercising and going was getting a massage, because it helped them facilitate, like, oh yeah, I'm sore, but I'll go get a massage and I'll feel a little better. And that'll help me get to the gym the next time and the next time and the next time. I've had a lot of people like that. And in the same respect, I had people who were generally unhealthy that was their first step, is I want to start with a massage. And it started with body image and, okay, start with the wellness portion, get my headspace right, and then facilitate my physical well-being. And that was massage their first bit. Anything?
Quick question.
Yeah.
I have a student emailing me from the online, and she says,
all right, Judy.
She's an A, so they're supposed to be doing like HIV, medical error, muscular system, chapter 6. She only sees the HIV and AIDS and medical error stuff on MindCat. Have we unlocked all the rest of the stuff for them yet?
It should have been, because as I added it, I put the dates in, but stranger things happen. I can check it after I finish this lecture.
Just double check.
So
She said
she's only seeing AIDS, HIV.
Yeah, she's only seeing the day one stuff.
Okay, all right,
She's not seeing muscular system or chapter 6.
okay, I'll check it. Yep.
Oh,
Oh, I don't have any Post-its. This school is low on Post-its. I got a marker here.
What are we doing, chapter 6 right now?
I have one, visible. And Lorianne showed me these. And so I've been using, these are actually from 5, but I've been using
Mhm.
them as like kind of my pull through. I don't know how I was going to teach a Zoom and a People's. Seems to be facilitating it a little
It's
easier.
pretty good. I mean, the slides are a little outdated because they go with the last two.
Yeah, we're kind of, this is our high points. Let's go to the juice.
Yeah.
All right, mind tap, day 1 and 2, not visible, cohort 1. Hopefully I remember what all that means later. All right. Dankeschön. All right, so conditions relieved by massage. This is it. All right, this is our last day. Tones facial skin and prevents blemishes. We're still continuing on from this. Relieves headaches, eye strain, insomnia, joint pain, restores mobility, reduces adhesions, promotes healing, reduces sense of self-confidence and control. Powerful stuff. Contraindications. Now we talked about that a little bit ago. In our book here, we see contraindication means that the expected treatment or process is inadvisable. It is going to be more harmful than it is going to be good for the person. Any symptom or condition that makes massage treatment inadvisable because of the inherent risks involved. Excuse me. Many conditions that are contraindications for massage are conditional and adapting the treatment reduces risk. So it's not always all massage is contraindicated and they can't get it at all, but perhaps a portion of their body can't get massage. So contraindications, speaking of, can be absolute, regional, or conditional. We can highlight when we get our books these bulleted areas here. A contraindication is absolute when massage is absolutely not appropriate, such as cases of severe uncontrolled hypertension, abnormally high fever, shock, acute pneumonia, or toxemia during pregnancy. Let's use our medical dictionary.
High chair.
I know. When I sit in them, they make my legs go numb. I think I will sit. My back hurts. We have
I went into it.
so and specifically to massage or to pregnancy. Toxemia can also be referred to as preeclampsia and is a vascular condition. Did you watch Downton Abbey? Oh, never mind. She died of preeclampsia. It's high blood pressure, swelling in the hands and feet, and protein in the urine. Potentially dangerous pregnancy complication characterized by high blood pressure. Preeclampsia usually begins after 20 weeks of pregnancy in a woman whose blood pressure had been normal. It can lead to serious, even fatal complications for both mother and baby. So, in a pregnancy, if you have high blood pressure, regulating it can be difficult because of medications that you need to take may be contraindicated for pregnancy.
Right.
So you need to be careful of that. If someone's blood pressure is not regulated with medication, we cannot perform a massage on them because one of the number one things massage does is improve circulation. So if their blood pressure is already high, it's going to elevate it even further, which can bring them into an unsafe place. So that's why we ask on an intake form, it looks like a doctor's form, right? But we have to know all these things to make sure that it's safe for them to get massage. And so part of your job will continue to be educating your clients, like, I'm not just rubbing lotion on you.
Right.
I'm performing a healthcare service. You know, and you have to kind of shift their mind frame, like, even though we're in a spa setting, maybe, or like a chain, right? This is still part of the healthcare field.
Right.
And we have to make sure that they know that. Some people have flat out refused to fill out medical forms because they thought it was too invasive, because they didn't understand that we are governed by the Department of Health. And that's fine, that's their choice, but I will not perform a massage on you unless I get an accurate medical history, period. And that's your choice, and it's my choice too, because I have to protect myself by protecting you, client. So if you don't fill out my form, you cannot have a massage from me or anybody else in this building if it's a chain, right? See ya, good luck somewhere else. Now, there might be a therapist that would do that, but I tell you what, they're not gonna be a therapist long, because something's gonna come along where they're gonna hurt someone, they're gonna trot their little butt to the board, and the board's gonna be like, well, where's their intake form? Where's their medical history? Did you know this? Did you know that? No. Okay, well, you don't get to do massage anymore because you weren't protecting the public. That's your number one goal, is to protect the public, period. I'm really passionate on that because I've met some pretty lax therapists that are like, it's not right. And I'm like, you don't know. It's not all right. It's not all right. 100% of the time, it's not all right. Where did I leave off? Contraindication. We talked about toxemia. Regional or partial indications prohibit administering massage to only a local part of the body, such as local contagious conditions, open wounds, or acute neuritis or arthritis, but massaging other areas is fine. So this means the one part where this is happening, we avoid, right? But we can massage elsewhere. Conditional contraindications require the practitioner to adjust the massage and take adaptive measures in the presence of health concerns for which certain massage techniques might cause discomfort or have adverse effects, although other therapeutic applications are beneficial. The practitioner must know when massage is advised, but more important, know when it should be avoided, or when certain strokes or movements should not be used. So if someone has, let's say, osteoporosis, right? And they come in and they say, I want a deep tissue massage, right? Right? That should be your first warning signal. Okay, so you've got some like brittly, holy bones, and you want me to push on you deeply, right? No, ma'am. You are contraindicated for deep tissue massage, right? Or we could be using deep compressive techniques and snap her little radius in half.
Oh my God.
Right? Something that wouldn't bother someone normally who was healthy, but since she has this condition, it's contraindicated. Can she get massage at all?
Yes.
She can get light effleurage, right? We would also need to be careful with range of motion with her, right? Because range of motion involves moving a joint, and a joint is an articulation or a movement between bones. That's something else we would need to be careful of. Traction, maybe a little light pulling, but it's just going to depend on the frailty level. It's going to depend on the frailty level of the client. You know, like I said, people are resilient, but once we start adding in all these conditions, we're like, okay, let's just play it safe. You know, always err on the side of caution. Baby step into stuff.
What about varicose veins?
Varicose veins, not directly on.
Like was all in relation with either leg.
Yeah, basically. Yep. Like spider veins are okay. We're not going to use deep pressure, like where we're seeing little like kind of splintery light. We can do like lighting over that, but we cannot do deep pressure. And those varicose veins, the structure of the veins essentially collapsed, and that blood is pooling there. So we have the instance for blood clot. And so what if we start massaging on top of that? And we just loosen up a missile, basically a death missile.
Yeah.
Right? So this is why we have to have all of this knowledge piled up in here, and books upon books upon books upon books about it. And then also other therapists. And Google is your friend. Right? If you are not sure, is this a contraindication for massage? Pop it in there. It will tell you. If you still aren't sure, say no. Protect yourself and protect them. And they might not like it. That's not your problem. Your goal is to protect them first. So it's for your own good. All right. A client's reason for having a massage and a client's current health condition should determine the therapist's choice of massage techniques. So as you do your health intake, they're a very in-depth form. And some people look at it, I have to fill this thing out. I didn't bring my readers. I don't know what to do. Can you read this to me?
No.
Well, I do read it to them. Or if it is like in a digital form, when I worked at Massage Envy, we had digital forms on an iPad. The older population, technologically, kind of an aversion to it. So you just kind of have to be soft and explain, like, this is just how we do our documentation now. It's just clicking some buttons. Would you like me to help you? It's a little extra step, but you've got to kind of establish a relationship with them,
Right.
and be able to work with them. But you have to be able to discern what techniques you're going to use because of all the things that each box that they ticked, you have to know, okay, I can use this, I can do that, I can do this, I can't do this. Okay, I move on that. We're not going to use heat, blah, 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 all the way down. It is the responsibility of the practitioner to understand fully the indications and contraindications of massage. You'll always have a book to back you up, but we need to have a baseline knowledge, right? We need to know the absolute no's, and we need to know the absolute yeses. That's pretty easy. There are some nuances with the regional or special case, like we talked about on the last page, that you can fact check yourself and talk with peers and whatnot. Which is one of the reasons why I do like working in the chains, is when you work as a solo therapist, unless you like join AMTA or some of the other FSMTA where they have meetings, having contact with other therapists, it's kind of sparse unless you work in a big area. Where I worked was pretty small fry, very small town, 14,000 people is where I used to live, right? Yeah. So there were therapists, but everybody was kind of like their own single entity.
Right.
And going to FSMTA meetings was an hour, hour and a half, 2 hours away. Just wasn't reasonable. Up here, you're going to have more options to be in groups like that are going to be closer by, 20 minutes, half hour away, whatever. But having access to other therapists and just being able to kind of, not say client's name and say, Bob Jones is this, but, like situational, what would you have done in this situation, to someone who understands the business and the training and all the knowledge that you have to kind of bounce ideas off of, and, just kind of have industry backup, We're in the beauty industry as well. So working in a salon, you can kind of get some aspects from other beauty professionals, but it's not going to be the same as talking with other therapists, which is why I like the chains, because you are in there with a bunch of other therapists, and generally you all have the same ideals. We talked about that one. Okay, so contraindications for massage: phlebitis, aneurysma, hematoma, edema, lymphedema, cancer, high blood pressure, fatigue, intoxication, psychosis, medications, and drugs. So some of these are physiological things that are happening in the body, like our cancer, lymphedema, edema, high blood pressure, fatigue, intoxication. If a person comes in and you can smell alcohol, you do not give them a massage. If a person comes in and they look impaired, you do not give them a massage, right? It doesn't matter that they say it's okay. They are incapable of giving their consent because they are
How
not.
would you go about that situation though? Would you just be like, oh, I don't feel comfortable?
Yeah, would you
know?
openly say like, I smell
Be
it?
like,
I would-
"Drugs, lady, oh.
I would try first to diffuse, like, I'm sorry, something has come up.
Okay.
You're unable to complete your massage.
Okay.
Now, if they're drunk, they might be a little bit more belligerent. At which point you just have to say, ma'am, ma'am or sir, I can smell alcohol. I, in good conscience, cannot perform a massage on you if you are under the influence of alcohol. I'm sorry. You know, and it should be cut and dry like that. When you add alcohol to situations,
Have you ever experienced anything like that?
we did have a couple come in that came in after they had been on the boat all day, and they had had several bottles of beer.
Were
Being
they
on the
okay
boat,
with it though?
they-
Like, did they try to be like aggressive or were they like, okay?
they
I
weren't happy,
understand?
but they weren't like, I'm calling the cops. Da, da, da."
Yeah.
It was more or less like, well, no, I'm not coming back here, and it's like, okay,
Okay.
well, I'm sorry about that, but we can't, in good conscience, legally, mentally, we cannot perform a massage on you, and physically on them, right? They are impaired. Same goes for medications or drugs, either legal or illegal, because some drugs change the way you perceive pain, right? Right? So if you can't perceive pain, how are you going to perceive pressure or pain resulting from said pressure? So if you're under the influence of some sort of medication that's interfering with that, I don't know any medications off the top of my head. I'd have to look at a pharmacology book, which I have. Books and books and books and books and books. Every time we move, my husband's like, are we going to keep all the books? Every single one of them? I'm like, yes, I am. I paid a lot of money for those books. We are keeping them. So they go in a suitcase when we move. We just roll like a big, it's probably about that tall, and I just stack up all my massage. Yep, all my books go in a suitcase. Yep, you just wheel along. It's a real heavy suitcase, but you just wheel it along. But yeah, getting texts like that are just, you'll have books. You'll have books on books on books. Where was I going with that? Oh, if they can't perceive pain from a certain massage manipulation, and they go home and now they, whatever medication has worn off, right? And they have bruising or more pain than when they went in, right? That's going to be your fault, right? Because you didn't do your due diligence to find out if they were on any type of medication. And the same thing goes with people who take recreational drugs. You can usually see that they're clearly intoxicated, and that would kind of fall under that intoxication standard conversation. Not that it's ever standard. It can get wild. I've never seen it get crazy, but I've heard it can get wild. And then psychosis, that's something that's happening physiologically. But if someone is not in the right mental state, they are incapacitated and cannot consent for themselves. Right? I've never experienced that. So
Is that a
I can't
question
speak to that.
on like the intel, the
Amblex?
Or no,
The form.
the form that.
Oh, are you currently psychotic?
Yeah, like, are you like?
I have seen it where, are you under the help of are you under the care of a psychiatrist or
Okay.
things like that.
And then would you ask them like, what are you seeing them for, or?
No,
you would go into detail?
I think more or less, if someone is there and able to fill out a form properly,
Then
I mean, psychosis is
like a mental,
like actually having a psychotic episode.
Yeah, I'd say,
Okay.
That's how I perceive it.
You might be able to figure out like if they listen to the medication.
Oh, okay,
For
but if
certain
they
things, you
have-
might be able to like, without being like, hey.
Yeah, what do you have?
Yeah, exactly.
You cray cray?
Are you
Yeah.
crazy?
Right, no. Yeah, and there are ways to eloquently approach topics. But identifying, we'll pop into this a little later, maybe, no, not tomorrow, you guys aren't here tomorrow.
Is Saturday hours the same, 8:30 to 4? Okay.
Okay, abnormal body temperature. Let's move on to common massage contraindications. Oh, right, we're just gonna stay there for now. Major contraindications include abnormal body temperatures, acute infectious disease, inflammation, high blood pressure, cancer, fatigue, intoxication, skin problems, pregnancy, and scoliosis, to name a few. More important information about contraindications discussed in the following sections. So, abnormal body temperature. Normal body temperature is usually 98.6, or please file this away in your brain, 37 degrees Fahrenheit. There is a test where they ask for the Celsius, 37 degrees Celsius, excuse me. File that in your brain. There is a test where they ask for the Celsius, and I think it's rude because we don't use that system here, but
Not in Canada.
it's just doing it to trip you up. So learn them both. You'll see temperatures throughout the book. Just always learn the Celsius, just in case. But this can vary depending on the time of the day or other factors. Normal body temperatures can vary from 96.4 to 99.1, or 38.5 to 37.3. I personally, well, before I was pregnant, now I'm a little higher because I'm baking a human, so I warmed up a little bit. But normally before I was pregnant, my temperature would rest around 97.1.
Yeah.
So when I would get to a temperature,
Yeah.
something like that, when I would get to a temperature of about 99, 99.5, 99.8, I have a fever. And my husband's like, it's barely a degree more. And I'm like, no. I'm like, this is an average. I run lower, right? Which is why I'm always cold. Right?
Yeah, I think all of us,
Yeah. So it is an average, but that is the average we need to know. But yeah, so when I would experience a fever, it wouldn't be like I have one of those thermometers that it shows you green, yellow, and red. And when it would show me my temperature, it would say green. I'm like, no, that's not green for me. That's definitely yellow. My husband's like, you're fine, go to work. Like, turned out I had the flu, so take that, buddy. All right, then we see acute infectious disease. Pneumonia, severe colds, influenza, and similar illnesses preclude massage. Giving massage to a person who's coming down with an acute viral infection, cold or flu, tends to intensify the illness and also expose the therapist to the virus. Massage is systemically contraindicated and the client should contact her physician. Now, rarest the case, flu season, people kind of confuse that general fatigue and soreness for like, oh, I just need a massage, and then like 2 days later they're full-blown sick. That's why we have questionnaires to be like, have you been exposed to anybody with a flu? And especially now after COVID, I mean, we're going to need to be a little bit more vigilant. I don't know if you heard on the radio, the Hand and Stone CEO, he was talking about they've got a commercial and how they're building new intake forms to be able to accommodate this new variable called COVID. Our industry is going to have to change because of it. I mean, the whole world is changing. Look at us now. We're sitting in here with masks on, right? Who'd have thunk? You only see this in like Asian countries where they had the severe cases of the H1N1 and the
Their population is so much
and the bird flu. They're denser population. I mean, 1.3 billion people in China and in India. Can you imagine? Can you imagine?
I can't even remember here.
Yeah.
Right? Like,
Yeah, congestion is real over there. But here we are across the world, everybody wearing masks. It's amazing. It's just amazing. Yeah. You've already been on it.
I have a question about a video when you're done.
Okay. All right. Inflammation. When a particular area of the body has acute inflammation, massage is inadvisable because it will further irritate the area and intensify the inflammation. This is particularly true for spreading or penetrating types of massage manipulations. Inflamed joints contraindicate massage of the joint itself. However, some pressure point applications are useful. Therapeutic touch, which is simply placing your hands on or near the inflamed area, can be helpful. That's the power of positive touch, right? I believe in the power of positivity. There is a research that was done, and I don't know the guy who did it. It was in Japan, and what he did is he took beakers of water and he wrote on tape mean things, ugly, fat, stupid, whatever. Labeled the water, froze the water, took it back out, put it under a microscope, took pictures of it, and the water's frozen shapes were like these unsymmetrical, cuboidal, like not pretty shapes, right? So he thaws the water out, makes it liquid again, takes the labels off, and puts new labels on. Smart, pretty, intelligent, whatever. Positive thing. Same water, freezes it, takes it back out, takes pictures of it. And you know how snowflakes form? Those pretty crystalline, symmetrical shapes? All water looks like that. Just by changing the labels on them. So if your intention to put hands on someone is positive, imagine what that can do for someone. So I believe in the power of positive touch. And I'm not one for energy work. I'm not into Reiki. I'm not into chakras.
I'm so excited.
That is a Lorianne topic. She will get all up in that with you.
Oh my God.
But I do believe in positive energy. I'm just not, I haven't dove headfirst into it. All right, so inflammation from tissue damage. When tissue is damaged, the body's natural response is inflammation. Inflammation is characterized by the following: swelling, redness, heat, pain. I think we've all experienced these when we've hurt something, right? First thing it does is to get red and get hot. There's pain involved because you probably just hit it, whacked it, broke it, whatever. And there's usually like a welt of some sort. And we talked about varicose veins. Go ahead and turn the page. We've talked about osteoporosis and varicose veins a little bit. This is the picture here on the side of 298, a vein valve. That's what I was talking about. So when the blood pumps and it all moves, right? Because it moves with the pump of the heart, right? When it's moving, those valves open. And then when the pump stops, it comes back shut. Now, when we experience varicose veins, those valves, instead of when they open up, we let blood go through, and then when it's healthy, it closes and blood can't backflow. When it's collapsing, when its structure isn't a healthy structure, instead of closing, it either inverts back the other direction and blood can go the wrong direction and starts to pool, right? Or it doesn't close properly, and so we have a yeah, it's kind of like a backflow, right? And we see on page 299 the foot there. That's an example of varicose veins, and so they've kind of collapsed, right? Their structure isn't they aren't held up in their original position, so they've kind of condensed themselves. They've come towards the surface. They're protruding because they have a backflow of blood. And if things aren't moving forward, we're going to have blood clots in there. So we're just going to keep our hands off of those. All right. Phlebitis is inflammation of the vein. Well, the word phleb means vein, like phlebotomy. All right. Itis, when you see itis, that's going to be inflammation. When we are talking about veins, we will see the word a thrombus. Right, that just means a blood clot or an embolus. Post-surgical. This is going to become important down here because we do have an elderly population. Lots of them are getting their hips done, or they're having to have their shoulders done, or a knee replacement, right? And they don't understand issues that they may have post-surgically that may be exacerbated by massage. So even though their scar has healed and they're only 4 weeks out, they're like, it's fine. They had me up and walking when I was in the hospital, day up, I'm good. And I'm like, nope, 6 weeks minimum. I also need a note from your doctor to make sure there's no contraindications that go with your condition, right? But working on scar tissue from surgical intervention, when scar tissue forms, it's not what the body has created initially, right? It's not that beautifully organized and structured piece of flesh. It's like, oh God, we have a cut, we have to heal it. Go, 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 sending in all those pieces that we need to close the wound, right? Mm-hmm. And so it's unorganized, it's got too much fiber, it's just like, whatever, just close it, use whatever you got, throw it on there. So when we use massage to help break up those adhesions and reduce some of that fibrousness, we can facilitate some more movement because that tissue is broken up a little bit. I'm sure you've seen like a knee replacement where they straight down the knee. Sometimes that adhesion can limit the movement of the flesh on top of the knee. So you can be helpful post-surgical, you just have to make sure you're doing it in the right time frame. And always get clearance from their doctor. Err on the side of caution. A neurosa or an aneurysm is a localized dilation of a blood vessel, more commonly an artery. It can be caused by congenital defect, arterial sclerosis, hypertension, or trauma, and is generally located in the aorta, thorax, or abdomen, or sometimes in the cranium. Although this condition can appear, it is rarely encountered in massage. If suspected, a referral should be, they should be referred to medical attention. So,
I didn't know you could actually see an aneurysm. I thought they just happened.
I don't think you can see the aneurysm. I think it's just its placement.
Oh.
But we can affect the tissues that lie over it. Right, and then a hematoma. A hematoma is a mass of blood trapped in some tissue or cavity of the body and the result of turtle bleeding. Contusions or bruises are common types of hematomas that are generally not too serious. Contusions usually occur as a result of a blow that is severe enough to break a blood vessel. The escaping blood leaves a familiar black and blue spot. The blood quickly clots, and over time, the body naturally absorbs the cellular debris. The bruise changes color to shades of green and yellow and eventually disappears. So that would be local, right? We don't want to massage directly on top of a hematoma. Edema, circulatory abnormality, generally appears as puffiness or swellingness in the extremities, but is sometimes more widespread. Edema is excess accumulation of fluid in its spaces and has numerous causes. In some instances, massage is indicated, and in others, it is not. When edema is suspected, it can be easily detected by pressing a finger into the area. If the indentation remains after the finger is removed, edema is present. This indentation will take several seconds to return to the level of the adjoining skin and is called pitting edema. Local circulatory massage is contraindicated for all cases of pitting edema. Edema can result from an imbalance of factors that regulate the interchange of fluid between the capillary and tissue spaces. Other causes can be related to heart and kidney disease. Poison in the system affecting histamine levels that increase capillary permeability or an obstruction of lymph channels. If edema is related to pregnancy, it is caused by toxemia. Massage is definitely contraindicated. Then we have lymphedema. Lymphedema is swelling usually and an extremity when fluid accumulates in the interstitial spaces because it is unable to pass through the lymph channels. They do have training for lymphatic massage for people who suffer from lymphedema, but you must, to work on this condition, you must have that training. You need to know how to facilitate that. And it's very, 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 very light. It's not for me. It is not for me. High blood pressure refers to an elevated pressure of the blood against the walls of the artery. In a client with a history of high blood pressure, the physician should be consulted before treatment. The client might be taking medication to bring the condition under control. Unless it is severe, massage can help relieve some of the hypertension that accompanies high blood pressure. Any massage of a client who has high blood pressure should be soothing and sedating. Right? We don't need to do an invigorating sports massage on them. Cancer is a conditional contraindication for massage. Massage has proved to be safe for people with cancer and has many benefits, including relaxation, pain relief, easing of side effects from cancer treatments, and support of the immune system. And we talked about that earlier when we were talking about AIDS. It supplements the immune response. Of course, it is essential to consult with the client's physician and be a part of the healthcare support team prior to any treatment. And we will talk about that more in chapter 19, which is massaging special populations. Fatigue. In cases of chronic fatigue, the system is already overburdened, and there's little to nourish those overworked and exhausted tissues. When a client is suffering from chronic fatigue, massage should be extremely light and superficial to induce rest and relaxation. Over time, massage helps restore the client's energy. And then we talked about intoxication, psychosis, medications and drugs. Pregnancy. During normal low-risk pregnancy, massage has many benefits. However, there are concerns with massage in the first trimester when the fertilized egg becomes a floating embryo before it embeds in the uterine wall and begins developing into a fetus. The first trimester is also when the mothers experience most pregnancy-related elements such as nausea, vomiting, mood swings, and fatigue. Most miscarriages occur during this period, so it might be best interest of the mother and baby and practitioner to postpone the first prenatal massage after the 12th week of pregnancy. Your risk of miscarriage reduces to, I believe, 5 or 3% once you reach that 12-week mark. When we are facilitating massage, indirectly, some of the benefits of massage could be associated with spontaneous abortion or a miscarriage. That's all therapists avoid massage in the first trimester, and it's most people's policies in facilities to avoid it in the first trimester. After the first trimester, though, there's plenty of things that need to be massaged because the whole body is basically rearranging itself for the baby. The pelvis is starting to spread to accommodate a being. So the low back is having strain. And then we talked about the body, how it compensates for itself. You know, so you have a new walking gait. So a new set of muscles is being engaged to move you forward than you normally would. Mm-hmm. So you're just sore all over and miserable. And I speak from personal experience. I want a massage. A client should inform her physician of her desire to receive prenatal massage and obtain a signed and dated statement from the doctor that her pregnancy is normal, and if there are any complications, what they are, and which, if any, precautions should be observed. High-risk pregnancies contraindicate massage unless performed under close supervision of attending physician. Most of the time, they are massage therapists who work under the doctor in a hospital facility or their office. During the second and third trimesters, special considerations are necessary for positioning the mother on the massage table. The prone position is contraindicated because there is a giant belly in the way. Semi-reclining or side-lying position is preferred. Massage should always be soothing and relaxing. No heavy percussion or deep tissue should ever be done. Likewise, abdominal kneading and deep abdominal massage is contraindicated because there's a baby in the way. Skin conditions you can probably recognize pretty easily, since you guys have been through skincare already, but we'll talk about a couple of them. Acne, boils, broken blood vessels, bruises, burns, blisters, carbuncles, hypersensitive skin, impetigo, inflammation, lacerations, lumps, rashes, scaly spots, scratches, skin cancer, skin tags, sores, stings, bites, tumors, warts, or wounds.
Warts. What about moles?
Moles are fine. You're allowed to make new moles until you are 54, according to my dermatologist.
Really?
Mhm.
Oh, wow.
That's what she said to me, and I was like, that seems kind of late, and that's fine.
It's fine.
Because I always show up and every mole that pops up, I'm like, is it cancer?
Right.
Because I've had a basal cell, so I just assume that every single one is.
Oh.
So I'm a psycho. But moles are fine, and in fact, being able to recognize skin conditions is good for people. You may be their only contact, and you may be the only person that sees their back, right? What if they're widowed, widower, just someone that's alone,
Right.
right? And so something that turns up on their back, they've created a new mole and now it's changing shape. It's got an irregular border, it's raised, what have you, all those signs that we have for skin cancer, those ABCD. It's your duty to inform them like, hey, according to my textbook, what I have learned, this is changing shape. I would get it looked at by a dermatologist. I think everybody should go to the dermatologist every year to get checked out because of our exposure to the sun. It's just important. I wear sunscreen every day. As you can see, I don't go in the sun. This is tan. This is my tan. This is about as dark as I get.
Oh my God.
I reflect sunlight. The space station goes by and they say, look, there's Christina, that big old white beacon.
I'm 10. Oh my God.
No, but I already had a basal cell removed and I don't want to do that again. It wasn't fun. The funny thing is it looks like ringworm.
Oh.
And my doctor even said, she's like, that does look like ringworm. She's like, let's biopsy it anyway. Okay, sure, sounds fun. So he took a little slice off and she said, yep, it's skin cancer. It's just a basal cell. We'll cut it out. So she ended up taking for probably a circle, like the end of this pen, right? She probably took out about that much in like an almond shape.
Oh, where? On your face?
On my clavicle, over here,
I can see
like
it.
that. But she cut it along with my clavicles, so the shade of my clavicle kind of hides it.
Yeah.
And I massaged it a lot after it was healed. There were some internal stitches that didn't dissolve,
Oh.
so I had to break those apart. And I felt them pop, and it was,
Oh.
it was awful. Oh, yeah. But it did help me get some movement there because it was really adhesed. Hernia, a protrusion of an organ or body or part of an organ, such as an intestine protruding through an opening in the abdominal wall surrounding it. Hernia is also called a rupture, and massage is not recommended over the afflicted area. So we could have like a part of the intestine rupture through the abdominal wall and see it underneath the skin. We're not going to massage that. Right? That's going to require medical intervention.
Like, just push it back in. It's fine.
Right, no, we don't need to do that. Frail older people can have fragile bones, very sensitive skin, use numerous medications, and be under the care of one or more doctors. Gentle massage can be beneficial for older people, and they'll fall under your special populations where you learn more about them. Scoliosis, I'm sure everybody's heard about scoliosis. You have scoliosis?
No, I probably do though, because I'm like,
I try so hard to like.
Well, scoliosis is, we see here, the curve of the spine. You are probably talking about where you get that dowager's hump.
Hunchback.
And that would be kyphosis. These are just different medical terminologies. When a client has scoliosis or a crooked spine, a massage must be recommended by the client's physician and caution must be exercised, right? And these are severe cases of scoliosis. Some people require surgical intervention to be able to walk properly. Identifying endangerment sites. I'm going to kind of fly through these a little quickly. Endangerment sites, because of the possibility of injury to structures by certain massage manipulations, these areas are sites potentially of potential endangerment. In most of these areas, major nerves, blood vessels, bony prominences, lymph nodes, or vital organs are relatively exposed or vulnerable to deep manipulations or direct sustained pressure. So it's where structures of the body that are delicate or vulnerable are able to be palpated, and they don't need to be. We don't need to be poking on things. Right. Right? We don't need to be poking into all these vessels because we kind of need them to keep flowing blood, right? That's something that needs to happen to exist. So that's the first one we talk about here is the anterior triangle. We can see it demonstrated in the green area here. Then we see the posterior triangle. It's kind of flatter. It's the flat person, like right above the clavicle there. And then the little notch inferior to the ear, right? You can put your finger there and just feel how delicate that is, right? Then we see the axillary area, your armpit, right? That while it feels strong, that it's very actually a delicate area where there's lots of nerves and lymph nodes. Lots of times, people who get breast cancer will have a lymphadenectomy, where they'll take out lymph nodes from the axillary area so that they don't metastasize the breast cancer tissue, and then they'll have that lymphedema because they don't have the ducts to empty, and they have to wear those sleeves. You'll see that a lot. The medial arm, you'll feel there. I mean, just like palpation, you can feel there's not a lot of protection there. It's just basically vessels, nerves. And the cubital area, now, this is where you would get your blood drawn, right? So if we can draw out of a blood vessel there, there's not a whole lot protecting it, right? The ulnar notch.
Your weenus.
That's going to be right here.
Oh.
Right, a little bit further. Hi.
Welcome back. Hey.
You're on our Zoom meeting now.
Hey, everyone.
All right. Posterior view of the endangerment sites on the lower trunk. We see the lumbar area. If you were to put your hands back here, like right where your ribs end, that's about where your kidneys are. They are slightly protected, like here's your kidney and your last rib probably goes just like over the edge of it. So this whole portion, bottom portion of it is fairly unprotected, right? So we don't do like a lot of tapotement there. We don't do we don't like do deep palpation with like 1 or 2 fingers. We'll do like large gliding movements over there. Popliteal fossa, that's the back of the knee, right? We think about that. It's just a sheath, right? Protecting all those blood vessels, ligaments, and nerves.
If the lumbar area is an endangerment site, okay, so I probably shouldn't do this, but my mom, she has me walk on her back, and I always like to walk on that lower area. It feels so good.
Are you staying close to the spine?
No, she actually has me like just like my feet are going like above her cheeks.
I wouldn't.
Yeah, it's horrible. She always has me do
With your knowledge now, I wouldn't do that anymore.
I was like, oh my god.
I would keep that over her hips and maybe doing something like this, and kind of on the like where her hip comes out.
Right. Yeah.
But that area, that space between where the ribs are and the hip begins.
Yeah, she's like always like step right there, and I'm just like.
Maybe she can implement some stretching.
Yeah.
All right, and then we see on the anterior view, we see the anterior and posterior triangle, the axilla, the abdomen, right through here. Your diaphragm is going to exist, right? We don't need to be looking at it. Nope. And then the femoral triangle, right? That's going to be right here, essentially. It's fairly unprotected. There is lots of tendon sheets, but nothing of structure to protect all the things here. The femoral nerve, femoral artery, femoral vein, great saphenous vein, and lymph nodes. Right, so there's a lot of things that need protection there. There will be gliding you could do over, but percussion, deep friction, anything that's really poking and prodding, we need to avoid in those areas. And then we talked about the abdomen. All right. Lauren Lee, we have reached the end of our lecture. You will need to do the discussion and review questions at the end of this chapter here on page 306 and 307. And do you have any questions before we go today?
Is there a test for chapter 6 that we're supposed to be doing online? Because I don't see that.
Wouldn't it be awful if it was off the whole time?
I would scream.
She's just like,
No questions, Lauren? Oh, is there a test on? Somebody was telling me, Dave actually just came in and said that it's not visible, so I'm gonna have to check the dates on MindTap to make sure that it is visible for everybody, but there should be one. I'm gonna check it today here after lunch, and I should have it up by the end of the day, if it's not up. I'm sure there's just a button that I need to click. I see everything else, but only. Okay, I'll take a look at it, make sure that everything has the right date and is available. If you have any more questions, you can just shoot me an email. But otherwise, we will see you Monday. I had to think of what day it was. All right, bye-bye. Oh, that's not what I want. How do I stop screen share? I don't know what to do. Oh, here we go.
video.
Stop recording. End meeting for all.